And welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look.
So pickleball, as you've probably heard, is one of the fastest growing sports in America.
With its rise in popularity, there are a number of injuries physical therapists like William Stu are seeing among those hitting the court.
Some of the most common types of pickleball injuries are ankle sprains, strained muscles like hamstring strains, hip overuse injuries, and shoulder injuries due to a lot of times not warming up or not having adequate muscle strength before playing pickleball.
From teens to retirees, Stu says at times the injuries are unavoidable.
You know, you're going to have some bumps and bruises along the way, but it's a great way to stay active.
There are some ways you can decrease your chances of having to see a doctor.
If you hit the pickleball court, especially if you are a few years older, right, as we get a little bit more gray hairs, right, you need to properly warm up.
Health experts say warming up is one of the most underrated parts of playing sports, and it could play a key role in preventing injuries.
With actual functional movements versus just holding a muscle in a static stretch. Take 5 to 15 minutes to get your muscles moving, increase the blood flow, increase that tissue extensibility, and you will reduce your risk of injuries on the pickleball court.
Whether you tweak an ankle or injure a shoulder, if you have any unusual pain after playing pickleball, health experts recommend seeing a doctor. For this week's Ask the Expert, I'm Kelsey O'Donnell.
Adequate hydration just supports our entire body system in so many different ways.
From adequate sleep to mental clarity, registered dietitian Jalek Patel tells us there are a number of health benefits of proper hydration.
So being well hydrated is an essential part of good health. Think about water as an essential nutrient for our body, feeds every cell. And so we know that proper hydration supports risk reduction in constipation, in kidney stones, and then also bladder infections, because we know that water helps to flush out bacteria that's kind of sitting in that bladder.
Before your health takes a turn, experts say there are ways to recognize dehydration.
The telltale signs of dehydration, definitely thirst, skin's getting dry and flaky. You can also start feeling achiness in the body, loss of mental clarity. I can't think clearly. Your start getting really achy, your joints are hurting. Urine color, of course, is a good sign if it's dark in color.
How much water is needed varies per person. Patel recommends her male patients consume at least 15.5 cups of water throughout the length of a day and 11.5 cups for women.
It also depends on what you're doing. If you're out and you're exercising and you're perspiring profusely, that amount of water we would encourage more of.
But if you drink or consume more, that's okay too. She advises you to just be wary how much you drink all at once.
There is a possibility of overhydration. And that risk, you could start feeling also fatigue, dizzy, low blood pressure if we're consuming too much water. So there is that risk.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Do you remember what you ate for breakfast or how you got to work? They're everyday thoughts stored in and retrieved from our brains. The creation of those memories happens every day, whether we're aware of it or not.
It has to do with the encoding of new information, storing that for later use, and retrieving it for later use. We use memory every single day.
Dr. Benjamin Zwane, a neurologist at Bon Secours, says as you age, it's normal to forget things from time to time. However, according to health experts, forgetting things more often could be a sign of a cognitive impairment or a more serious condition.
Age is the biggest risk factor, and 65 and above is typically when the prevalence of the disease increases dramatically.
Common diseases include Alzheimer's and forms of dementia, but it's not only those in older age groups who are prone to memory loss. According to a Harvard Health study, thousands of people experience symptoms before the age of 65.
Unfortunately, there's nothing anybody can do to stop aging. People have been dealt the genetic cards that they have, but apart from that, education level seems to be strongly associated with developing Alzheimer's disease. So, finishing with a graduate high school degree or higher is associated with a lower risk.
Doctors say they have yet to find a cure for the more serious conditions such as Alzheimer's, but there are some ways you can strengthen your memory.
Anything that involves taking on new hobbies, new tasks, mental exercise, reading, crossword puzzles, and other activities that challenge ourselves cognitively. That's a great way to keep our brain working, functioning, and healthy.
Getting care is one of the most important steps too, according to health experts, and that should happen as soon as you or a loved one shows symptoms.
As soon as somebody develops symptoms of memory loss, they should seek medical attention as soon as possible. Okay. Primarily because there are reversible causes in some cases that can be corrected. And even if somebody is dealing with symptoms of Alzheimer's disease, we are at a stage of research where we actually have some treatments to slow the disease course, even if we can't stop it completely.
Health experts recommend talking with your primary care doctor or a neurologist to receive the best possible care. For this week's Ask the Expert, I'm Kelsey O'Donnell. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis.
There's a gut-brain axis or gut-brain linkage, if you will, where we are finding more and more data that our typical routine life does tend to affect our gut.
Medical Director of Gastroenterology at Bon Secours, Dr. Viral Oza, has been analyzing abdominal migraines for several years.
It's called a migraine because it comes in intermittent fashion, very similar to the traditional migraine.
The only difference, the pain is in your stomach. Dr. Oza says the most common symptoms include nausea, vomiting, and abdominal pain, often triggered by food.
Chocolates, citrusy fruits, that's something that's very commonly associated with abdominal migraine.
While migraines are more widespread among adults, doctors say stomach pain is more common among children. In a study by the National Institute of Health, medical professionals say the majority of children often overcome the condition by their teen years.
Adults very, very rarely will have abdominal migraines. I saw some few case reports in literature that exist on patients being diagnosed with abdominal migraines. Almost always, more than 90% of the time, it is in the pediatric population. And typically, like I said, age of diagnosis is around 7.
Medical professionals say diagnosing abdominal migraines can be a challenge, which is why it's important to keep track of what foods you and your child are eating and when the pain and discomfort occurs.
It's very hard to get a history from a child, right? I mean, think about it. If you're 7 or 8 years old child and your parent asks you what's wrong, you say it's hurting. Well, what's hurting? Everywhere. Where it's hurting? Here. So it's a very vague answer. So getting an accurate history from a child is very important.
Doctors say treatments are similar to how you would manage a regular migraine: drinking more water, taking pain medication, and limiting outside stressors. Health experts say most children will outgrow the pain. For this week's Ask the Expert, I'm Kelsey O'Donnell.
And to move at your own pace with those exercises and listen to your body.
Physical therapist and mother of 2, Mary TP, says no matter how fit you may be, the period of time after giving birth, known as postpartum, can at times be a mental and physical challenge for many women. But health experts say resources like exercise can help boost morale and promote wellness.
Postpartum running can be a great outlet for women.
TP says postpartum running is a proven way to improve physical fitness, help reduce stress, and improve quality of sleep for some.
It's just important to move at your own pace with those exercises and listen to your body.
Listening to your body is what medical professionals say is the key, and knowing how soon is too soon to lace up and get moving.
Generally, we recommend waiting approximately 12 weeks to return to running postpartum. That seems like a longer time period than most may think, but it does take a lot of time to rebuild strength after having a baby.
After having a baby, there are a few things to keep in mind.
It's important to remember not to just pick up a brand new exercise right after having a baby.
Medical professionals say starting something new or returning too soon after childbirth can cause unwanted pelvic pressure or pain, lower back and hip pain, or could put you at risk for other injuries.
Hormonal changes that happen throughout pregnancy also extend into the 4th trimester or after pregnancy. These hormonal changes can also cause issues with stability in the joints of the pelvis.
So before you suit up and hit the trails, know that starting slow and steady when the time is right oftentimes wins the race.
Just understanding how to build up exercises slowly and knowing that this period of life is temporary and that you are able to get back to the goals that you would like to achieve, whether it's running a marathon or just participating in an exercise class once a week.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Health experts say there are dozens of causes for hearing loss, and for more than a decade, Bon Secours' Dr. Amy Calchery has been studying the why behind the medical condition.
There are lots of things that can cause hearing loss. Age is one of them. Different medications you've been on throughout your life. The biggest one is noise exposure, but it's also genetics and probably a couple hundred other things that we're not entirely sure of yet.
While hearing loss in some cases may be unavoidable, doctors say there are ways you can decrease your chances of losing your hearing.
The biggest thing to prevent hearing loss is wearing hearing protection anytime you're going to be around any loud noises. OSHA does a big thing with that for companies. My kind of good rule of thumb is if you're standing next to somebody and you need to scream for them to hear you, it's probably too loud of a situation. You should be wearing hearing protection.
If you're consistently having trouble hearing people speak, have to turn up the volume to hear the radio, you have persistent ringing in your ears or dizziness, it may be time to see a doctor.
Anytime you are noticing that you're having trouble hearing, especially if there is a sudden change in hearing. If you wake up one day and go, I'm not hearing as well as I was yesterday, call your doctor immediately.
From hearing aids or medical treatment, doctors say they can help you lay out a treatment plan that best suits you.
The biggest treatment option for hearing loss would be hearing aids. That is the most common treatment, but for some types of hearing loss, there is surgical or medications that they can put you on. It really ultimately depends on the type of hearing loss that you're having and what's causing it.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
Surgery can be a solution for treating disorders of the musculoskeletal system.
So for instance, fractures, ligamentous injuries, like ACL intercruciate ligament tears, rotator cuff tears.
That's Alan G. Poster Jr. He's a sports medicine fellowship trained orthopedic surgeon with Bon Secours St. Francis, treating patients who eventually put too much wear and tear on their shoulder.
It occurs because the rotator cuff tears and leads to degenerative conditions in the shoulder, and those are treated in a variety of ways, but oftentimes can lead to the need for a joint replacement.
Poster Jr. says the words joint replacement can be scary for some to hear.
People are afraid of orthopedic surgery because it hurts. And we have made great advances in terms of orthopedic surgery, both on the surgical side and the success rates.
He says surgery results rely on the health of the patient.
We assess a patient by physiologic age, meaning that you can have surgery into your 80s, sometimes even into your 90s if you're healthy. If you're not healthy, that's a different situation.
For some, surgery might not be the only solution.
For the bulk of orthopedic conditions, the mainstay of treatment is non-operative treatment. Non-operative treatment can consist of physical therapy, medications like anti-inflammatory medications, Motrin, and sometimes injections.
With today's advances, orthopedic surgery is changing.
Most total shoulder replacements 10 years ago required a hospital stay. But just like in the hip and the knee, we are moving towards outpatient surgery for the right candidate.
Ultimately, he says it's up to the patient to determine if the long-term benefits outweigh the short-term pain.
People undergo total shoulder replacements and are productive and happy, and most importantly, allows you to do the activities that you want to do later on in life.
I will tell you that I am where I'm at today because of this sweet lady.
It's a bond that's strengthening at Bon Secours between Susie Crosskey and her physical therapist, Debbie Smith.
Well, you did everything you were supposed to.
The duo sharing the signs, symptoms, and steps you can take to lessen your chances of living with lymphedema. According to the CDC, it's a chronic condition with persistent swelling caused by a buildup of lymph fluid in the body, and there are a number of causes.
The most common reason in the United States is due to having lymph node removal or as a result of cancer surgery.
That's how Susie Crosskey came into the picture.
I was diagnosed with breast cancer in March of 22.
For the past several years, the two have been working together to prevent lymphedema, a common after effect of cancer treatments and other surgeries.
And generally, it is about 4 to 6 weeks that people have to come to therapy.
After I had my surgery and treatment for breast cancer, I started treatment right away with mobility and lymphatic drainage, and then started wearing a sleeve to offset any symptoms I might have had.
Those are few of the treatment options Smith says the team of physical therapists at Bon Secours helps with, including manually draining lymphs, fitting patients for compression garments like sleeves and bandages, and creating a proper exercise plan.
Lymphedema cannot be cured, unfortunately, but it can definitely be reduced.
While Crosskey remains at high risk for the chronic condition, she tells us she's confident in the work she's been putting in and hopes others will do the same.
Don't let things get out of hand before you take steps. I think that was key to me having the good results that I've had.
Preventative measures and treatments, strengthening health and a friendship at the same time.
Thank you.
Thank you.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
The spine is really the cornerstone of the physical health of the body.
It's quite literally the backbone of our lives. Director of Bon Secours Pain Management, Dr. Daniel Atkinson, says spine health contributes to mostly all of our day-to-day tasks.
Cracks in that foundation can result in dramatic changes to how we function, how we move, and our comfort from a day-to-day standpoint.
So when things take a turn and stiffen up, challenges may arise.
We all have to understand that with life comes pains and aches, especially as we age. So as I mentioned already, over time the structure of the body loses that cushioning. It loses that pliability that we all love and appreciate. We don't bounce back like we used to.
Doctors say there are a number of different spine-related issues they see patients for, including arthritis, degenerative disc disease, stenosis, pinched nerves, fractures, and other conditions. But the good news, health experts say some of those are treatable.
There are certain conditions that we do treat, either procedurally or surgically. Some of them we talked about already, the disc pains, stenosis, pinched nerves, fractures. We can do things for those, but typically what we try to do first is treat the symptoms that occur secondarily due to those conditions. So in other words, when you have a disc herniation and it's pressing a nerve, what we try to do is alleviate some of that pressure by doing an epidural basically injections, nerve blocks.
While health experts say injuries and age play a big role, the best way to try to decrease your chances of having uncomfortable pain starts with good posture and living a healthy lifestyle.
So stretching, exercise, try to be active if you can be active. So if that's standing up from your desk from time to time while you're at work, moving the joints, stretching muscles, going for a walk at lunch.
And if your pain persists, be sure to see a doctor and do what's best for your body.
And I would say the last thing would be regular follow-ups with your health providers. So they're going to watch you, they're going to ask you questions, assess you, do tests. They'll come up with treatment plans initially. And at the end of the day, if those treatment plans don't get you to the point where you can function and do what you need to do, that's what we're here for.
For this week's Ask the Expert, I'm Kelsey O'Donnell. That's a wrap on this week's Ask the Expert show here on WSPA Plus. Join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thank you for making an appointment with us today.